actor Chadwick Boseman died overnight at the age of 43. Boseman is best known for playing the title character in the Marvel blockbuster Black Panther. According to a family statement, Boseman had been battling colon cancer for the past 4 years. CBS News chief medical correspondent Dr. Jon LaPook is a physician and gastroenterologist. And John, this was just stunning to learn overnight.
Jeff, good morning. Yes, it's shocking news, so sad. And you know, African Americans have a higher incidence of colon cancer and a higher mortality from it. And when they get it, they tend to get it at a younger age, and it tends to be more aggressive, which is why some societies are saying, you know, instead of starting screening at 50, which is standard for most societies, the American College of Gastroenterology is saying, you know, if you're African American, start at 45. And the American Cancer Society is also saying everybody should be screened at 45 because for some reason, colon cancer is affecting people at a younger age now.
Run through some of the symptoms and signs. What should people be looking for, Doc?
Hi, Michelle. Well, yeah, first of all, change in stool. So that could be anything from a change in caliber. It could be more narrow. You could certainly have bleeding. You could have constipation, diarrhea. You could also have bloating, abdominal discomfort. The stool doesn't have to be red in terms of bleeding. It could be just black or dark. Unexplained weight loss, or if you're just fatigued and you turn out to have iron deficiency anemia, you can have iron deficiency anemia from losing blood invisibly in your stool. And by the way, I know a lot of people have diarrhea and constipation. It doesn't mean you have colon cancer, but if you have any of these symptoms, you feel something's just not right, please check it all out with your healthcare professional. You do not want to die of embarrassment. I know people don't want to talk about things like this.
Yeah, no, just quickly, those over-the-counter tests, would you recommend them?
Well, there are lots of ways of screening. You know, there are stool tests that you can look for DNA or blood, but the gold standard is to do a colonoscopy. And not only are you diagnosing colon cancer at an earlier stage, but you can actually find a polyp. Because, Michelle, in most cases, colon cancer starts with a very benign polyp, and it sits in there for 5, 10, even 15 years, benign, but it's growing. And if at any point in that you do a colonoscopy, you can not only find it, but you can take it out. And the person, instead of getting colon cancer, doesn't get colon cancer. So I would advise, this is a wake-up call and a reminder, even though it's a time of COVID and people aren't seeing their healthcare professionals as much, please check in and see if you need to get screened.
All right, Dr. Jon LaPook, thank you very much. And it's as easy as reminding a relative or a friend saying, listen, go in for this, get this done, it could save your life.
Yeah.